for joining us and for taking the time out of your Friday morning, which I'm sure is very busy, for our very first Navigation Spotlight. So, really glad that you're here with us. Before we begin, we'd like to acknowledge that we're gathering on the traditional territory of the Haudenosaunee people, the Mohawks of Akwesasne, who are the original stewards of this land. We honor their deep connection to this territory, which has existed for thousands of years. The Great River Ontario Health Team is grateful for the opportunity to work and live on this land, and we recognize that Indigenous practices of holistic health and well-being have been in place here since time began and continue today. We remain committed to building and improving relationships with First Nations, Inuit, and Métis people as equal partners in all that we do. Personally, my Hebert ancestors were among some of the first French settlers to arrive in Montreal from Normandy in 1642. They came as quote unquote missionaries, and this part of my family history is tied to colonial systems that attempted to erase Indigenous culture, language, and spiritual practices. Reflecting on this history continues to strengthen my commitment to truth and reconciliation. For me, this acknowledgement is not just a statement, it's a reminder that reconciliation is ongoing and requires learning, unlearning, actions, and humility from all of us. Yeah, so I'll take a moment now to share a little bit about this series. The navigation table of the Great River Ontario Health Team identified as part of their work plan the need to share more information to our community about the many navigation services that exist across the community. I'm just going to ask anyone who's not on mute to just mute themselves, or maybe I can mute you. I've done that. Perfect. And so we decided to reach out to the Social Development Council of Cornwall SDG and Akwesasne, who have had this ongoing and very successful community spotlight series, and wanted to work with them to create a partnership where we could maybe, I say, hijack one of those spotlights every month to bring light to these navigation partners that we are sharing. And so the Social Development Council continues those community spotlights, mostly spotlighting individual community agencies on the second and fourth Friday of every month. And we are now starting to do the third Friday of the month, specifically on navigation services. So these are services that can support your clients navigate the very complex health and social service sector that we all work in. These will continue on the third Friday of every month. Right now, we are scheduled right until January 2027. And so we've got a lot to come. And I want to just highlight some of the upcoming ones. So you will be receiving information on registration for these in the very near future on May 15th. Access MHA and One Stop Talk will be sharing the hour. And on June 19th, Access CSS will be joining us, and we'll share the rest of the calendar with you as they come about. And if we're missing any partners that you may be aware of, please don't hesitate to communicate with myself or the navigation table so we can definitely get them on the schedule. We can definitely pursue this far into 2027 since there's so many great partners to spotlight. So to kick things off, we're pleased to welcome John Hoyle from 211, or Community Navigation Eastern Ontario, as our first spotlight. 211 is an incredible partner in our community and plays such an important role in helping people find access to the right service when they are most in need. I won't steal John's thunder, so I'll pass it over to him in just a moment. But before we do, just a couple of housekeeping notes. If you don't mind, stay on mute as John does his presentation so there's no feedback. There will be time for questions at the end, and so definitely chime in then. Come off mute, put in the chat, whatever you're comfortable with. But John is here for the hour with us, and so certainly time for questions. And if you have to leave, we don't want you to leave because we want you to ask your questions at the end, but if you have to leave, or if you know folks who couldn't be here today, we are recording. We will be putting this on the OHT's YouTube channel and then sharing it broadly with our membership and with the SDC's membership as well, so that recording can be watched time and time again, so that folks can be well aware of of all the wonderful work that John and his team do over at Community Navigation Eastern Ontario. So without further ado, John, I turn it to you.
Thank you, Carolyn. Uh, Hello, everybody. It's my great pleasure to be here. I have a little bit of pressure being the first one, so I got to make sure I don't screw it up. But I want to just say before I get to the PowerPoint that the real point of all of this, of course, is to get people to connect it to what they need, whether it's health services or other things, and I'll talk about that a little bit in my presentation. I'm aware that probably many of you know who we are. However, what I'm going to do is just refresh people's memory about how we do our work. I can tell you that our emphasis is always on providing the highest quality of support to people that we can possibly do. I am going to take a couple of minutes at the end to talk about what the future is going to look like in terms of navigation and share some things that are already happening in parts of Ontario that we hope in the 211 system to have across the province eventually. Some pretty exciting stuff, actually. And so I'm going to just share my screen now, and I'll be happy to answer questions. And if there's something that is confusing or if there's something that you'd like clarified right away, I don't mind. If I know it's a little bit difficult, Carolyn, but if somebody wants to pop a question in the chat that maybe you can tell me about, Carolyn, while we're going along, because I don't want them to lose the thread. If they want to ask a question about something right away, that's fine too. So now, this is the biggest difficult part for me as to whether my technology limited abilities will make sure that I can share.
I have full faith in you, John. Oh, perfect.
Okay.
That's great.
Thank you. Okay. So just before I get into the slides, I've been in this job as the Executive Director of Community Navigation for 8 years now. It'll be, which I shake my head. I can't believe where the 8 years went. And I want to just say to all of you working in this area, when I joined Community Navigation 8 years ago, I knew about things, but I knew nothing actually, in the sense that I spent 20 years as the CEO of the Canadian Bar Association, and I was on a committee. I was the association chair for United Way. Knew that there was all these things going on, but I didn't really know the challenges of social services and the struggles of so many agencies being underfunded and trying to do way too much with way too little. And so it was a real eye-opener for me. But when I stand here now, this is the best job I've ever had, because every day I get up in the morning and know we're going to help 250 to 300 people today and get them connected to what they need. And so what better job can you have than doing that? So here's how I'm going to, as I said, just going to run through this as a refresher for some and maybe new to others. We handle all French language services in the entire province. For the last 2 years now, almost 2 years, we here in Eastern Ontario are 24 hours, 7 days a week, 360 days of the year. I'm not going to bother this. You folks know all about 211 numbers. We're free. And we have the most comprehensive database of community social health and related government services in Ontario. And from our perspective, we hope that we're the first point of access to human service resources throughout Ontario. Our provincial partners, I have 4 colleagues that provide the same service across the province. I'm going to refer to a couple of them during my presentation, but local social planning, Lakehead Social Planning Council runs 211 in the north. Find Help is Toronto and the GTA. Windsor, the Southwest, and Community Connection, Central East. 211 for a long time was sort of in different places. After COVID, with federal government funding, it's everywhere across the country, wherever you may live. Targeted, live, and most importantly, confidential help. And we have certified community navigators I'm going to talk about a little bit more detail in a minute. It's multilingual. We can handle more than 180 languages, as I said, around the clock. And the most important bullet on this slide is standards driven, which I'm going to explain briefly because it's really important. One of the things when I make presentations, particularly to municipalities, when we can work with them. Yes, I will be showing it. One of the things that we do is we help out municipalities when there's disasters. And so when I make presentations to council, I did one in Prescott Village about 4 weeks ago to council, because they were looking at signing an agreement with us that when there's a disaster, whether it's a flood or whatever, they can call us and we'll take all the calls and answer when people are looking for sandbags and so on. But they want to know that we're credible and that we're not some fly-by-night organization that if they make an agreement with us and then we don't deliver, then it's going to make them not very unhappy. So the standards are really important in terms of what I talked earlier about the high quality of the work that we do. So this is not for you to try to read every one of these. We are an accredited organization. There's the Alliance of Information and Referral Systems is a North American-wide accreditation program for people in the information referral business, whether you're a library, whatever, all kinds of different people get certified. So there are 28 standards, and you have to be, as an organization, accredited every 5 years. Just last February, got reaccredited for the third time. We started 211 in 2008 in Eastern Ontario. And then both our navigators and our curators, I'll talk about in detail, they have to, once they've been with us 9 months, they have to start their certification process. And they write pretty difficult exams. And then every 2 years, they have to write a sort of follow-on exam to recertify in their roles. So we're primarily funded by the Ministry of Children, Community and Social Service and United Ways. Also, a number of communities. United Way Stormont Dundas Glengarry, for example, is one of those funders. The county government, and then as well we get support, very significant support from the City of Ottawa, City of Kingston, as well, directly from them. And we look for money. We're one of the participants in Catch the Ace. We're not one of the big players. We only got $15,000 on number 7 of the Kin Club of Russell, but every penny counts, as you folks know. So we have 3 parts of the service: public inquiry, online directories, and caller needs. The total contacts in 2025 were 308,655 in the province. There were 827 calls from SDG. The public inquiry, we can answer the calls. Obviously, we have live people 24 hours a day, but we do chat and we do text, as you can see here, and of course, and we do email. And interesting enough, we do get a fair number of emails. Now, the navigators. We hire. It's very challenging for us. But we've had very good results lately in hiring people that are perfectly bilingual, who both and have writing skills as well, because they have to write an after-call report and that type of thing. And we train them very rigorously. From the time the person starts, we have new people starting on Monday. It'll be 8 to 10 weeks before they actually take a call. Some of them may be a little earlier because they're, people, go faster or slower in the learning process. And their job is to conduct an assessment. Some people will say to me, John, all you guys do is give out phone numbers and my blood boils. Okay. And because it's a lot more than that. We also advocate, and I'll talk about that more in a second, and we conduct follow-up in situations. And you can see the list here of some of the training that our folks have. De-escalation, everybody's required to do the assist training program as part of their training as they become start being navigators. So this is just a quick visual of how the calls work. Somebody calls in, bonjour, how can we help you today? And just statistically, we do give out information only, but 85% of the calls we take, we do referrals. And it's only 15% that actually is where it's just saying, well, yes, this is the address of the local food bank, that type of thing. We do a needs assessment. So it won't surprise any of you that what happens is somebody calls and they say they have problem A, and then you probe a little bit. Somebody might be calling about, looking for a food bank. So we talked about, is there other options might be better, such as Meals on Wheels for you? And then is it a barrier for transportation to get food to you? Are you struggling with your utility bills? Because and then you say yes, and so it's a multiple referral. The other thing that happens sometimes is that during that assessment, people think they have problem X, but when you start asking all these questions and having this conversation, it's actually something very different. And so that we look for people that are empathetic and curious to be navigators, but also diplomatic. So then, and on the advocacy side, we sort of have two levels of that. Once the navigator's been at it for by 5 or 6 months on the lines, they get a sense of how people are going to do with the referral. And you get people who are very clear. This is where it is. This is the place you have to go to, and we always say to them after the calls. And if you don't have success or anything, please call us. The second one is where we think they're a little unsure, and so what the navigator will say, what the navigator will say is it okay if I phone you back in 24 hours to see how you did? And if they give a consent, we will then follow up. The third situation where they can tell the person probably is going to take this information and maybe not do anything just because they're shy or they're uncertain. And what we'll do then is say, well, why don't we call the agency together? And at that point, we actually do warm transfers with actually explaining the situation until such point as that person is connected with that organization, and then we back out of the call. And if we're getting a call at 8 o'clock at night, we will say to the person, "Can you call back tomorrow morning?" The agency opens at 9. Call us about 9:15, and we can then follow through with that warm transfer. We really, I can say to you that the navigators are very, very focused on finding solutions. You will appreciate these days that the biggest frustration, of course, for them is if they can't find something for somebody, because they take pride in doing that. But you'll appreciate these days when it comes to shelter and housing, there are many calls where there's, it's hard to find a solution. And my biggest job is to make sure the mental health of my team is okay, because of the fact that there are a lot of difficult calls. And people, one of the things we in the training, people are going to be rude. People are stressed when they call us. So we have a fairly high tolerance, but we don't tolerate abuse. And when there's abuse, they say, look, if you don't stop, I'm hanging up. And the other thing, we have, fortunately, across the province, we have a group of psychologists that know the work that we do. And we have an employee assistance program, but we have above that, we have this program where these people know what we do, and our folks can call them if they're struggling because their own mental health is being impacted by the work. The other thing is we also, of course, when we have those unmet needs, I'll talk about this in a little more detail, we keep track of that. We have data coming out of our ears, okay? So as some of you know, we keep track of the calls in SDG. I send a report to United Way, SDG every quarter, and to the Social Planning Council. As a result of that, you see exactly what's going on. And the list that's most interesting to most of all our United Ways and different municipalities that get this information, and we'll provide it to any organization, is unmet needs. So you can see where the gaps are. And I'll show you some examples of that a little later. So we have... Yep.
John, there's a couple of questions in the chat. You told me to stop you, so I'm stopping you. Phyllis has a couple of questions. How does 211 learn about new community services? Currently, they're on board with standard services and regular renewals. That's the first question.
Okay. So make sure, Phyllis, I answer your question properly. First of all, we really encourage... We have it's perfect timing for the question, because we have 7,000. Actually, we have in Eastern Ontario, we have almost 10,000 records of services, and we really encourage our folks that if you are in the database, if you add a program or you take away a program, please let us know. So because that database is the engine for our navigators. That's what they use to find things. We also, when sometimes there's a gap when people have fact our data curators, they'll go into a particular, let's say they'll go into SDG and they'll start Googling and seeing if there's any new services they can find that we aren't aware of. But I find probably the most effective way, Phyllis, is word of mouth. because some agencies talking, well, we have with, and oh, or a new group has gotten together. Well, have you registered? Have you got your resource with 211? And that's the other thing um, we have I'll get to this in a second, but we have a very rigorous approach for making sure records are up to date, which is really key. As part of our accreditation, we are required to maintain records that 85% of those almost 10,000 records are updated at least once yearly. Okay, so we do a system where we send out an email. We take that 10,000 divided into 12 months, and we send out emails saying, "Would you please update?" We then do a follow-up with a second email, and then we don't get a result. Then what we do is we'll actually phone. And sometimes when nobody will respond to us, we'll then go to the website of that organization, and if there's a note on that website, it was updated within 3 months, we'll take the information from the website. When sometimes it's just difficult to get in touch with people. So the data curators.
There's a second,
Yeah,
sorry,
yeah,
John, a
yeah.
second
Go ahead.
question from Phyllis.
Yeah.
What search strategies do you have the most success with? Food security, abuse, finding a doctor? Maybe Phyllis can clarify. Do you mean like which requests are coming in the most, or?
Just a
So
second.
how do you search for the strategies when you have a caller on the phone?
I'm not quite sure I understand the question, but I'll try to answer it and then correct me if I have not gotten it. It basically, what they do is somebody calls and they say
Yes.
they want, well, I'll use a common one. They call us and they say, "I can't pay my hydro bill."
Okay.
So our people are when the part of their training is to learn about all the different programs. So for example, there's the LEAP program. So they'll know,
Okay.
and they'll go to the LEAP program and try that. And then with let's say not unusual, but uncommon things they're calling about that we don't do regularly. Because once the navigators get into it and they've been with us, they get better and better at it because, okay, I've dealt with this before, so okay, I know where to go to find that for that person. But other ones that are, as I said, uncommon, what they do is they will search our database. And there's a number of they have obviously we have a taxonomy of terms of where you can find different things. They're trained about that, and they'll go and look there. And I will say, Phyllis, that also sometimes we can't find anything, so they'll do what everybody else does. They'll go to Mr. Google. And they'll even try that because their goal is to find that help for the person. So they're prepared to sort of turn over every stone that they can find. It's a matter of pride, I would say, with our navigators to try to do that. But sometimes they can't. That's just the way it is, as I talked about housing. So the data curators are actually, this is a job I could never do. They have to be really, really detailed. They have to like detail. The database, just so you know, between the north in Thunder Bay and central east in Collingwood, the three of us are integrated because the other standard we have to meet is answer 80% of our calls within 80 seconds. And sometimes we get a queue. So if we get a queue here, a colleague, a navigator in Collingwood or Thunder Bay could take the call. Now you say, wow, what do they know about Eastern Ontario? They are trained exactly the same way. They have the same standards and everything else. So they know how the system works. Now, if there's some really intricate geography question that they just would not know, they will then take the call back to us here in Ottawa. And we will do the same if we pick up a call from them. But why that integrated system is so helpful, it means we can take more calls. And what we can do, because if it's quieter and we've got a very busy time and it's quieter for the navigators in Collingwood, then they can pick up those calls and people don't wait and they get the service that they need. So, the data curators are so important because it's all that information that needs to be in there. They have to edit. In the fields, if it's not in the right place, the navigator won't find it. So these people have to be perfectionists. And so it's a job, as I say, that I find very difficult to do because I'm a big picture guy. I don't like getting into whether the I is dotted or the T is crossed. So, and they contact all this in organizations. I said earlier, and they use technology to share community resource data, and I'll talk about that in a minute. And you can see some of the training that they have. Okay, so this is the website that I would suggest you use to look for things online. You know that there is a Ontario 211 Ontario .ca. That whole website is being redone, and it has some search challenges. You'll see that these are some of the icons that are on there that you can go to. And this site is updated every evening. In other words, any changes made by our data curators during the day, by that time at midnight, the changes will be made. And just to let you know, when somebody sends in a change, or we do, especially when people sometimes, because you can email changes, which I'll show you in a minute. But the big thing is that doesn't go live instantly. People say, well, I sent that into you, it hasn't gone up yet. A data curator has to check it, because it has to be in the right place so that they can search it. So if you send it in today, probably by the end of business tomorrow, unless it's on a Friday, like it is today, it would be Monday. That will be checked before it's then released to go live into the database and into the website. And then the other thing is you have a search by with how many kilometers, but you also have proximity. So the proximity, that is with, if you want to say, well, you put your postal code in and you say, this is where I am, or your address, and then it will give you the proximity where the closest food bank is, for example. And this is just sort of the answer to some of the different headings for health centers. Just for example, this is on the health side. And then I use the Agape Center as just an example of, this is an actual resource that you would see if you went online. It's also what the navigator will see, but the navigator has another part where there's other notes that would not be for the public, but there's some information that the organization wants us to know when the navigator opens up the resource. So you have the numbers, and then the next page of it shows who the executive director is, and when was this one updated? Where can I find it? This one is in need of an update. It was November 10th, 2025. So again, I'm going to note that because I don't understand why it hasn't been updated. Well, no, it's not fair because it's a year. So we still got a few months. I'm being too hard on ourselves. And then a plea to all of you. One of the things that I find the most important thing I can ask you for is constructive feedback. We try to do the best job we can, but sometimes we miss. And that's what I want to know about. None of our navigators is going to do anything, or our data curator is going to do something deliberately, but we're not perfect. And so that if you have some feedback for us, if you go on and something said, well, this isn't right, you've gone to some organization and they've shut down, for example, we want to know about that. And I also want, this happens, fortunately not very often, where maybe a navigator is having a bad day and they might have not been quite as good as they should have been. We want to know about that. And we don't use that as a gotcha. We use that as a constant and continuous training of people. And so just as part of that, as part of our standards, every navigator, our coordinator, we have a quality assurance and training coordinator, listens to 4 calls of every navigator every month. So what they do is they're all recorded, so they'll go on and listen, and if there's something that's not quite right, they pull it out. Then they sit down with that navigator and say, let's listen to this call. How do you think this might have gone better? And then suggest the things. So there's sort of constant training going on in that sense, and that's all about maintaining our quality of work. Now, this is the caller needs, and this is, as I said, we don't mine this data as well as we should. We just don't have the resources to. But we do capture demographic information. It's not scientific because we've been pressured by all kinds, the ministry, all kinds of organizations. Say, can you get a whole bunch of demographic? Can you ask about gender? Okay. Can you ask about age specifically? Can you ask a series of questions? And we did a test, and we had one of the tests we did a pilot in both Thunder Bay and in Collingwood, and asked a bunch of questions at the beginning. People got really angry with us because they kept calling about a problem. So then we tried it at the end, but then we started asking things, can we ask you about your sexual orientation? And people got really angry about that kind of thing. We're here to help people. So we don't ask those questions. But what the navigator does, if somebody's calling, they're looking for something for a senior, well, they can note that that's the age bracket. So it's not scientific. It's not something we could use to say this is it, but it gives us a sense of the people that are calling us.
I
Now,
have
this
another
is,
question in the chat, John,
yeah,
if you want to just pause
got it.
there.
Okay, I think I've got
William
it from
is,
Miriam. Yeah,
yeah,
I've got it open now, so thank you. Yeah, this is a question you're going to see in a minute, Miriam. We'll see one of the categories of unmet needs is don't qualify for the service, and or the other one, quite common, there's a waiting list for a service. And what we do is we try to look around to see if there's a or maybe a partial solution. Okay, if I could use that term, where we'll say, look, there's something else that might help you. I'll give you an example, which I won't give you the names of the organizations that we have across the province and pretty well in every area, where there's a couple of places that we'll have their phone number and they'll say, look, we have a little bank of money. Like, I know we have urgent needs funds. I know that, SDG, I know that in across the province, there are urgent need funds, which you can refer people to. But this is even beyond that, where we just know that we can phone that place and say, somebody's looking for something, could you help? And we'll try that. So we try to sort of use the informal approach, Miriam, where we can. It doesn't always work. And that's when we get to the thing of unmet needs, that'll be in that report. So you can just see here that in the total needs identified in SDG for 2025 was 1,142. And then it's broken down. We can break it down by all these different areas in SDG. With the bulk of the calls coming from Cornwall and North Stormont, and then different numbers as it goes down. And you can see the needs, and the yellow is the current ones, and the blue ones is from the previous year. And some areas were up more, some are down a little bit. And you can see the areas. Now, on the total, and this is very small on the screen, I know, you can see the different areas, housing, what people are calling us about in SDG. But we can drill down 3 levels below that. So when you have, where's the one I want to have? Food, it's not just food banks. It's, Meals on Wheels. So will somebody deliver groceries if those services are available in the particular area? Now, this is the one that I think people find the most useful, and it's unmet needs. And you can see that there were 56 unmet needs identified in 2025. And you have it right here, ineligible for service, there were 8. Can't afford the service, there was 1. And inquire unable to connect with the program. Okay, another reason. So hours of the agency did not meet the needs. And again, you can see where those were. And when you see with unmet needs in the pie chart, it's the obvious areas that you would think. It's no surprises there in that sense. One of the things I just want to comment on is, as I said, there were 1,100. What did I go back? Can I go back? I'm not going to go back. I'll screw it up. But we are always trying to grow the number of people that call us. And the biggest challenge we have, and it's going to be my plea now, and I'm going to do it again at the end of this, the biggest challenge is people knowing about 211. We've never had the resources to do a full awareness campaign. And at one point I realized maybe that's not a bad thing, because we better make sure we have the navigators to answer the calls if we had an awareness program, so that we can serve people properly. But it's really helpful if you could be champions of 211, because and I'll tell you a little bit more about why I think about that in a minute. So I'm now just going to switch. I'm at pretty well at the end of my presentation, but I wanted to talk to you about some of the things that are going on. I'm going to talk about 2 things here. Actually, going to focus on 1: community information exchange. And that is a idea that came out of 2-in-1 in San Diego. So let me tell you a little story about why this is really important. My colleague Pam in Collingwood had a family call. A woman called the navigator and said, "I've got some problems. I don't have enough food," and so on. And they dealt with that. 2 weeks later, that person called and said, I'm really having trouble with my children. You know, they're getting really out of hand, and I could really use some help. So they helped. We resource. Third call is, you know, I'm having some real mental issues. I'm worried about maybe the Children's Aid Society, and so her situation was going down, down, down. In the system we have currently, our navigators don't know the history of that caller. It's because they're dealing with a different navigator and there's no tracking of it. So community information exchange is now being implemented as for the first place in the province in Central East, Collingwood, you know, Simcoe, Grey counties, and so on. And it's a very interesting. It changes things entirely in terms of how the work is done. There's longitudinal tracking. So what happens is it's a different intake way when a person calls, and what happens is they take the call, and the call is kept there with the person's phone number. And when the next call comes in from that person, up pops on the screen automatically that they called before. So then you know that this person, okay, and the key part of it is there is a triage system, and it's color coded, not surprisingly, red, yellow, green. And what it will allow us to do is if we get those people that are in the red zone after you do the triage, they're going to get the attention first and make sure. And this whole community information exchange is connected to a whole bunch of different agencies in Collingwood. So I don't know, I'll say, I'm trying to think of an agency. So I'll say Children's Aid as an example. They will have access to that, and they can go and look at certain things. Okay, they're using the Ocean platform. This is with my colleagues, so that in terms of medical stuff, security is there. So you can, if the person's been made a referral to so if there's been a referral from a doctor, which they do there now, and is hopefully coming to Eastern Ontario soon, doctors are making social prescribing things, and they send them currently by fax still, but that's changing with the Ocean system, to 211, and an outbound call is made. And the outbound calls, I think, are going to be the future for 211. We're always going to have the inbound calls, but to help people more and to sort of not be case managers, but to make sure people are making sure that connection, because we don't always know whether they made the connection, but with this system, you'll know. So it is really, really exciting. And so just connect up everything, because the one thing I think we all experience here and people around this table right now is sometimes the person is getting help from several different places and they don't know. So there could be duplication, but this system will allow everybody to know what's going on with that individual. Now, I haven't explained this very well, Carolyn, so you may want to, at one of your other navigation things, get Pam Hillier to come and make the presentation about CIE, because she is an expert on this, and it is coming. One of the great things we have with the 5 agencies is that we all are doing different innovative things. I'm doing a lot of work on organizing spontaneous volunteers during disasters. Our friends in Pam's doing work in this area in the health field and making sure that everything's together. She's taken even a further step. I spoke to her last night actually, and she was just driving back from Aurelia, where an office is being set up in their new county building, and all the partners are there. So the 211 navigators are going to be there in that building. When people walk off the street, they'll be there working with mental health people, okay, all the people, and they're doing it together. And so that 211 person will be there, and they will be involved in getting that person, making sure they actually get the service they need. I think that's going to be the way of the future. I mean, it sounds like these days in the digital world, you're going backwards, but not. It's that personal contact that is so necessary. So it's really exciting that's happening, and it's real. And what we do is, because, of course, like everyone around this table, don't have a lot of money, so Pam's developing it, and then we'll all steal it from her at no cost. Okay. And what I do, and the other place, like Find Help in Toronto, has been the leader in community crisis response. You may have heard on the news that we are now in Ottawa, we are the dispatch for the Anchor program, which is a community crisis response. Instead of sending police, we're sending people with lived experience and mental health, support people, and they go out and we dispatch the van to go to those particular situations. And it's now being expanded in a huge area as of June 15th. And so we learned all of that from Toronto. We didn't have to build it from scratch. They just gave us everything they did, and we did that. So that's the kind of thing we're trying to do in terms of navigating the whole system for everybody. On the other area that's really interesting is e-referrals. So what we're looking at, again, Pam is the one that's doing this, and I'm running out of time. I better watch my time here. E-referrals, where what's going to happen is an agency can do an e-referral to us. We're not doing it here, but she's doing it there. And then, so you send an e-referral, the navigator reads it, and they then do the outbound call to the person. It's like another equivalent, but not just for doctors doing social prescriptions, but for other kind of e-referrals. And it obviously makes sense. It's just a good way to do it. That's why I think over the next couple of years, we'll keep doing our inbound calls. It's still really the core of what we do, but then the outbound calls are going to result in better outcomes for people. That's why I think they're going to be so important. And the other thing I'll just mention, we do customized portals for a number of organizations in Eastern Ontario. Here's the thing. Your organization gets some money and they get a grant, and so and Carolyn, you're going to laugh, and they're going to build their own database. Okay. Carolyn's smiling because she told me she didn't, when I first met her, she said she didn't need us because she was building her own database, but I changed her mind on that. Anyway, sorry to tease you, Carolyn. In any event,
like over a decade ago, let's be clear.
No,
or nearly.
Okay,
no,
okay.
8 years ago.
8 years ago, you're right. But in any event, and so you get the grant, and sometimes people will call me and I'll say, well, we're going to have our own database. And I ask them one question. How much money in your operating budget have you got to keep that database up to date? What do you mean? And I said, well, 2 days after your database is launched, something's going to be out of date. Oh, yeah, well, yes, because things are going to change. So I said, instead of doing that, and we actually have an arrangement with the Ottawa Community Foundation, if they give grants for somebody they want to have a website and a database, they say you have to go and deal with us because there's no point in building a database because ours is up to date all the time. And so I'll give you, if you go on a thing called Connecting Ottawa, which is legal services for new Canadians, you'll look at their icons. It looks like it's all them. It's all powered by us, and we have an agreement, and we build those for people and do that. And now, it costs a bit of money, but it's a lot less than the private sector would charge. So that's the other thing I just wanted to mention. We talked earlier about emergency response. We have agreements with over 16 municipalities across Eastern Ontario. I was going the goal to get everybody in Eastern Ontario, and then COVID hit, so I'm now building back on that to get more municipalities. I just sent out a note to all 16. Don't remember it's flood season potentially, and because the people have agreements with us that they signed 3 years ago, the staff have changed, and they don't remember they have the agreements. So just did that lately, and this is some of the events that we have. And Carolyn, I went on a little bit longer than I intended, but I hope I didn't put people to sleep. I can tell you that, as Carolyn knows, I am very, very passionate about this work. I'm happy to come and make presentations anywhere. Phyllis mentioned my colleague Daniel makes presentations. We have, the other final thing, we have material. Tear cards, which is a card with information you can tear off the bottom part and put it in your wallet. We have fridge magnets. I've got more fridge magnets than I know what to do with. We just moved offices. They weigh a ton, and it was a slug to move them here. But I'm just saying we have things like that. We have 2-on-1 pens. So if you're doing an expo or doing a meeting with groups of people, when I come and make presentations, I always bring goodies with me so that that is available too to help us make people aware and remember that they can call 2-on-1 when they don't know where to turn. I'm done.
Thank you so much, John. I've seen this presentation a number of times and I've worked with you for quite a while, but I always learn something new every time I hear the presentation, and really love to see all of the innovation that is happening across all the different 2-in-1 providers. So hoping that we can hear more of that. I've made some notes, and so may reach out for some contacts. I want to see if there's any questions before we wrap up today from anyone that's still with us. Mel, go ahead.
Sorry, I accidentally raised my hand. I meant to put the clap emoji because I always love and always learn more every time I hear John's presentations. So thank you so much.
Thank you, Melanie.
Well, I think saying it out loud is better than the clap emoji, so it worked out. Got some thank yous in the chat. Any questions or comments before we wrap up today?
John,
I have. Okay,
Yeah,
Miriam, go ahead.
You can definitely bring some pamphlets and some cards at La Santa Santé. We'd be more than welcome to take some up to you.
Okay, and let me tell you, people, here, I have better news. All you have to do is email. We will get my email address. I think is. Yeah, there it is. I know I stopped sharing the screen, but if you'll circulate the PowerPoint,
yes.
Carolyn. Okay, I'll send it to you right after the call. Yeah, and you can. We ship it for free. You tell me where you want it, okay, and we'll ship it right to your door. Just send an email to me making a request, and then give me a delivery address, because we use Perlator to send the stuff to you. And so if you ask me, usually within, depending, we have a person here that looks after that, and depending how busy they are, it might be a few days, but you'd have it usually within 7 to 10 days. And when there's an emergency, as Carolyn knows, we can get it to you overnight. So
perfect. I know we had some, but I went downstairs, I added some pamphlets. I'm like, oh, it would be great to have 211. I seen it at the hospital yesterday when I went for yoga, and I'm like, we should have some 211 information. Yep. Yeah. And so just thinking about today, right? So yeah.
Thanks, Miriam, and just send an email and we'll get it to you.
Perfect. Thank you, John.
Okay.
And so I will share. Go ahead, John.
No. Okay. I just wanted to share a final thought with you, if I could, Carolyn. Yesterday, my colleague Daniel made a presentation to the Ottawa Food Conference, and I just want to read a little bit about this, especially with this group. And that is basically, I'm going to just quote from it because it's so good. And it's just towards the end of his presentation. He wanted to raise an important point. None of this work happens in isolation. 211 is a resource not only for individuals seeking help, but also for the network of frontline workers supporting those individuals. It's a place for everyone or anyone, whether you're a concerned neighbor, a social worker, a food bank volunteer, can get connected to accurate, up-to-date information about services in your community. Think of it as a knowledgeable, approachable colleague, someone you can turn to when you're not sure what's available or what the next step should be. And it helps us move from the reactive responses to more sustainable solutions, from isolated interventions to integrated support systems, from crisis management to future building, from surviving to thriving. So I leave you with that.
I appreciate that, John, especially since I know that there's several navigators on this call, and I know that myself and others, who've worked in the sector for a long time, folks assume that we're very well connected and we know the answers to everything, but we don't. And I have multiple times in the past told frontline workers, other navigators, to just call 211. Don't wait for your client to call. You can call and you'll have a navigator support. I've done it myself when folks have reached out and I'm not sure where to point them in the right direction. They will speak to folks that work in the sector and support your work. So definitely, I see this as a service that's not just for the patient or the client, but for all of you as well, to help fill the gaps when you're not sure where to turn.
And have PowerPoint will travel. So I've said we're ready to make presentations. Okay.
Perfect.
Thanks.
I will share all of this with those who've registered and beyond, and be ready for folks reaching out for supplies, John. I'm sure you'll get a few emails.
Okay. Thank you all very much for your time. All the best.
Have a great weekend.
Enjoy the sunshine finally. Take care. Okay, bye.